Good morning to all. Today we are seeing the diabetes mellitus. What is diabetes mellitus? The diabetes mellitus is the conditions which glucose level, increasing the glucose level in the blood, that is called diabetes mellitus. It is also known as the sugar disease. It is also known as the sugar diseases, that either the pancreas does not produce enough insulin, or it produces sufficient insulin, but the cells of the body are unable to use the insulin properly. Okay, then diabetes mellitus. It is a chronic metabolic disorder. It is derived from diabetes. It is derived from Greek word the diabetes running through, and mellitus means sweet. It is increased blood glucose level due to the insufficient, deficient, or failure of insulin secretion. This is the most common pancreatic endocrine disorder. The incidence of two type diabetes, the first one is type 1 and type 2. Then first one is type 1 diabetes. This is the pancreas secrete the pancreatic juice. The hormones are called insulin. Decreased insulin in the blood vessels due to the increased glucose level. Then muscles unable to use glucose due to low insulin. Then glycogen and protein breakdown causing ketoacidosis. Then type 1 IDDM, the expansion of insulin dependent diabetes mellitus. IDDM accounts for 10 to 20% of the known diabetics. The conditions also occurs in children, juvenile onset diabetes, and young adult. It is sudden and can be life-threatening. So this is caused by the destruction of beta cells of the pancreas. It elevated the blood glucose level, that is called hyperglycemia, from inadequate insulin secretion. What about causes? Genetic inheritance and environmental factors are causes for this condition. Then what about diabetic type 2 of diabetes? Pancreas. This is the pancreas. Sufficient insulin secreted in the bloodstream. It has increased glucose in the bloodstream after the muscles unable to use glucose due to the insulin resistance, to the form of obesity, inheritance, and other factors leading to insulin resistance. Then next one is diabetic, the expansion of type 2 non-insulin dependent diabetes mellitus, NIDDM. It is also called as an adult onset diabetes. According to 80 to 90% of the diabetic population. So the pancreas is normal, but action is impaired. The target cells do not respond to insulin. What about causes? The causes of multifactorial, which include the increasing age affecting the middle age. What about the symptoms? The symptoms of diabetes, the main symptoms of diabetes are, this is the central nervous system. So the polydipsia, loss of water, leads to a thirst, so resulting increase in the fluid intake. Polyphagia, lethargy and stupor. Then eyes, blurred vision, breath, smell of acetone. Then gastric, nausea, vomiting, abdominal pain. Then urinary, this is a urinary bladder. Then polyuria and glycosuria, increased urine output leading to dehydration. And glycosuria, excessive glucose excreted in urine, that is called glycosuria. Then respiratory, breathing, hyperventilation, and weight loss and weight fatigue and loss of weight also. So this is a symptoms of diabetes. Then prevention and control of diabetes. We want to prevent and control the diabetes. The following methods are the diet, hypoglycemic drugs, insulin injection, and exercise or the management based on their type and severity and the condition. Then what about the dietary management? Low carbohydrate and fiber rich diets are more appropriate. Carbohydrate should be taken in the form of starch and complex sugar. Then diet comprising whole grains, millets, jowar, bajra, ragi. And what about green leafy vegetables? Wheat, unpolished rice should be included in the diet regularly. Don't forget, these are the some of the dietary management of food product. We want to diabetic patient should take this in this type of food. Then carbohydrate maintain the about 50 to 50 percentage of the total calories. The high protein content 10 to 15 percentage. Then fat content diet should be 15 to 25 percentage of the total calories. Then saturated fat intake should be reduced, and polyunsaturated fatty acid content should be higher. Management with insulin. Commercially available insulin preparation, short and long acting, also used to maintain blood glucose level. Then physical activity. It is a role in play. It is important for facilitating good control of diabetes, the strengthening and toning up the muscles. And education and awareness. We want to give good education awareness to the diabetic patient. We want to guide them also. People with diabetics should be educated on the nature of disease. We want to tell them they have and the possibility and complication of this disease. We want to tell about the complication. What are the complicated to the diabetes? If the blood sugar is not kept under control, instruction of recording diets, exercise and drugs should be explained. Then diet. Main principle is to limit the intake of simple carbohydrate. Refined or simple carbohydrates can be found in food like sugar and certain drinks, Coca-Cola and lemonade, and jams, cakes, honey, sweet, chocolates, etc. This food should be avoided because immediately raises the glucose level in the blood. Then glycemic index responds the magnitude in the increasing the blood glucose. Thank you.